Hi, my name is Yasmin Tarehi, and this is Gateways to Awakening, where we host one-on-one conversations with leading experts in wellness and spirituality. Today's show is about tooth fitness and how we can clear stored trauma in our teeth. On this show, we'll be featuring our guest, Samira Neba Wilson, a registered dental hygienist. She was licensed as an emergency medical technician and has completed training in oral myofunctional therapy and courses in traditional Chinese medicine. She was the honored recipient of the John Smith Fellowship Award and the American Dental Hygiene Association Award for Clinical Excellence. She currently treats individuals and families in a holistic dental office in Mill Valley, California, where she is a licensed dental hygienist and specializes in phobic, highly sensitive patients. She is also a medical dental intuitive and a Reiki master. Thank you for joining us today, Samira. Really excited to have you on the show.
Well, thank you for asking me. I'm excited to be here.
Great. So I know we briefly spoke about the context of the show, and I think there's so many people that are really curious about the emotional trauma that is in our teeth. And so, I'm curious, what type of trauma from your experience is stored in the mouth? How do you usually recognize it?
Well, it's interesting when I've talked to people about this. I like to say, trauma can come from many different places. We tend to not really think so much of how our body is impacted, our mouth is impacted by everything you put into it. I like to almost compare it to a film called like Water for Chocolate, and it's one of my favorite films. I don't know if you've seen it, but where the main character, she makes food, and in the food, she expresses herself. And anytime somebody eats whatever she's feeling, they feel it. It's almost like, thinking about when your mom made you, your favorite rice pudding, for example. It stays with you for a period of time. But, in the mouth, we don't really think about, the impact that somebody's putting something in your mouth. It's not going to last a couple of days. It's actually going to last sometimes decades. And so when you think about how that can profoundly have an effect on you, because the energy of the person who's working on you, or, if it was something that was sent to the lab and the lab technician was working on it, there's an impact that can potentially be there. I say it could be coming from somebody who's working on you. When we think about, unfortunately, in dentistry, it's got very high incidence of, substance abuse and suicide and, different kinds of addictions, divorce rates. So it's not, you typically people don't think about, well, here's this person who's going to be working on me, putting something in my body that's going to be staying. And what does that mean to me and my body? That's one way. Other things that can happen is it can be family. If your family has had a negative experience to dental work, that can also relay itself, because we if you're a sensitive person, you're aware of picking up some of that energy. You can also have certain trauma that's stored in your mouth that's coming from somewhere else in your body. So it's not always just looking in one direction. Okay, here's the mouth is the end spot. The mouth can be part of a whole line of things. It can be the start. It can also be an end spot. Something happening in an organ may show up in the mouth, and like that.
Interesting. So, so there's like this external type of trauma that comes from the dentist. There's an internal trauma that could perhaps be inherited from our families, some sort of intergenerational trauma stored in the mouth. And then the last is sort of this physical trauma that is found somewhere else in the body that either starts in the mouth or ends in the mouth. So interesting. And I think, that leads into my next question, which is, you talk about the specific emotional and physical meridians for each tooth. For a lot of
Mm-hmm.
people, we don't actually, I think probably most of mainstream America doesn't actually know what that means. What are the emotional and physical meridians for each tooth? Where did that come from? I think that certain people have certain problems with specific teeth over and over again. And sometimes that's within a family or that's within a relationship. So I'm really fascinated and curious by this question, and what this all means. So if you can explain that, that would be great.
Yeah, absolutely. So, the way, I talk a lot in metaphors and analogies because I see things as pictures. And so the way that I like to explain meridians is I say it's almost like having a string of Christmas lights that go, that run up and down your body. And on that string, you may have, one light that's, connected to your liver, another, on the same line, and then it's gonna intersect and have a tooth that's connected to that. So if you know about Christmas lights, sometimes a light can go off, or it might flicker, or and many times they will still work. The the electricity will still run through that meridian, but it puts a strain on the line. And sometimes there'll be one light that's flickering in one place, and then another place there's an impact because you want to have a clear, smooth circuit. Well, that's, it's looking at it energetically. If you have some kind of block, again, it could be, it happens in the tooth and, then impacts other places, or vice versa. One of the examples that I've created this acumeridian energy tooth chart, which brings together various other forms of charts that actually show, the Chinese medicine meridians. It talks, it shows in one place all of the different intersecting points of information as they pertain to specific teeth. There's emotional aspect to the meridians, and so I had shared this with somebody at one point, and I said, oh, here's your chart, and she looked at the tooth. We pointed to the tooth that was in question, and I said, oh, this tooth comes in when you are 6 or 7. Did you have anything happen to you when you were 6 or 7? And she said, oh, well, I had asthma. I was diagnosed with asthma, and I started having anxiety when I was about 6 or 7. I said, "Oh wow, that's really interesting." We just and I mean, I don't have the chart memorized. The beauty of having a chart is you can reference it, right? And we looked down the line, and it had asthma and it had anxiety, and it was, I know that tooth comes in at age 6 or 7, and it was there. And so for me, having that understanding that there is a correlation, I think one of the fundamental things is recognizing that our entire body, you're one whole being, and many times people don't recognize that there's a link and that you can have access to the rest of your body by what's happening in your mouth. It's something that I also find fascinating. Does that answer your question? I don't know if I went,
Yeah, yeah,
there's
no,
too much information.
yeah, it definitely does answer the question. And I'm curious. So that chart comes from Chinese medicine, and like sort of what types of modalities did it come from?
Well, so it's not new that people have been looking at the link between different organs and the mouth. So, yes, traditional Chinese medicine, many times, in China, my understanding is they wouldn't actually examine the patient. They would just have you open your mouth, and then they could tell from looking at your tongue the different organs. They could tell, they could diagnose because they weren't allowed to physically interact with a person. So they had to find another way to get this information. So I have many sources. Some of it was Chinese medicine. Some of it was just dental information that I know where the teeth are. So the point of this chart is for people to have an ability to do self-assessment. You can go online, and there's many, many different locations. There's a Swiss group that had a chart, and I pulled it. There was another abridged version of a chart that came from a different dentist. If you go online, there's many, But ultimately, I felt the need to bring together in one place a chart that has, the eruption dates, the development dates, the emotions, the organs. And, for example, this patient, she looked at that tooth. It might have listed asthma. It might not have listed anxiety. So I pulled anxiety from a different place so that it's all in one go. And I've also included elements and chakras that are related to the different organs so that you can, and that's not from any other source outside of being a medical intuitive. And I checked in, and that's the information that I got.
Got it. So you're really borrowing from a multitude of different sources to create this one comprehensive source. And I'm curious, Samira, can people find this chart anywhere online, or do they can they only find it by working with you?
If they go to my website, they'll be able to have to acquire it that way, or through contact with me. So it's my chart, although the information comes from other places as well as from me. So it's a collection.
Okay, great. So, now that a patient learns about the trauma that might have happened in their mouth, what can they do to actually clear that trauma? Do you have any tools and tricks or things that people can do to actually clear the trauma?
Yeah, I mean, that's a very good question. There people, when they come to see me, we use different meditation techniques. There is not, in my experience, saying meditation is a broad statement because each person's is unique and individual. And many times the person will come in and they'll have one specific concern, and they'll say, okay, this is my tooth, this is what's bothering me. But then what shows up is that it's not just that tooth. It's just that the tooth is what's calling for the attention up front. So different kinds of meditations, ways of clearing. I have people do exercises. Sometimes it's just as simple as having gratitude, So, if somebody has a tooth, for example, that was fractured and has to have a crown put on it or something like that, to just say, thank you, acknowledge your tooth for having done all of this work. I mean, if you've ever had someone work for you, you know that you get the best results with gratitude. And so just as simple as saying, wow, you worked so hard, you broke yourself. Thank you. I wouldn't be here without all of the effort of all of my teeth and all of you working together. It can be really remarkable. I mean, I have a patient who she'd avoided coming in for years, and she was just it starts to eat at you. So if you haven't been to the dentist and you say, oh, I need to go, and then you don't go, and then you feel bad that you didn't go, and then you don't go even more, and then it goes on and on. It becomes this vicious cycle. So to actually come in takes a lot of courage. And so I acknowledged her for having come in. And as I was taking care of her teeth, what I experienced from her teeth was that they were happy. There was joy that they're being taken care of. Right. And in the moment that I had that information, that realization, as I was taking care of her, she started crying in my chair. And this happens quite often, not because I'm hurting them, but because there's an emotional release. There's something about being witnessed. There's something about that. It's magical for me. And obviously it was for her too. She started crying. She put her hand to her heart and she said, I'm not crying because I'm hurt. I'm crying because I feel, I don't know. I don't really know why. I feel happy. And I said, yeah, because you took the step to do self-care. And some of us, when we think about our mouths, we don't think about, I have so much joy. I'm going to floss. Let me be loving. I'm going to brush. It's more like, here I have to do this. I have to do that. We don't have that experience with other things that have to do with our body, especially with parts of our body that work so hard for us, to keep us happy and alive. You go for a pedicure, you don't think, oh no, somebody's going to have to massage my feet. But you do with your mouth. And so I I'd like to kind of change the context. And so just changing the relationship of, here's this part of my body that I have to deal with, that's always giving me pain, that's always giving me a problem. No, who's going to want to be in a relationship like that?
Right.
So,
Right.
these are some of the techniques that I say, and in the end, when there's a part of you, this is, my sidebar assertion for what it's worth, is that if there's any part of you that you reject, you're going to experience that in your body. And, of course, I see that in the mouth. It's like, oh, can you just take care of my mouth, and I don't, I'll just zone out for the rest of this. And it's okay. It's just noticing that, if you had a relative that you did that with, they're not going to want to come and help you move.
Right. Yeah. So really reframing our relationship with our teeth is a really important kind of socialization that needs to happen, because you're right. I mean, I think everyone is nervous about going to the dentist. Usually there's fear around, having a cavity, or even something as simple as people poking and prodding in your mouth and in your teeth. So I think that's a great way to ignite like a new relationship with your mouth. So thank you for that. Can you tell us more about the stages and ages of tooth development and eruption and what that means?
Yeah, absolutely. So one of the things that I find amazing is that, and of course I'm going to find it amazing because I'm in dentistry. The part of us, so when you're born, your baby teeth have already formed, right? And so pretty much you come out into the world, and now you've got your organs, you've got, God willing, hopefully you've got all the stuff that you need. It's just smaller in size. And your baby teeth are, they're already formed, they're just going to come out. But at birth is when your permanent adult teeth start to form. And so for me, what I think of is, if when you're, in utero for various reasons, you may, if your parent may have felt stress, or and I am a parent, so there's none of this is, take this with a grain of salt. I'm not holding any parent or relative responsible. It's just a knowing that there's an environment, and when you have an environment that has stress, that's going to impact on whatever is growing there. So if you have, your mom or whatever, you're in utero, and now if there's trauma, it may come in any part of your body, which is where, this is the thought where sometimes it's something that's familial, and so, everybody in the family could be genetic or whatever, that has like a knee problem. Everybody has a knee problem, but it could also be that there's something that's stored energetically, traumatically, that's in the knee, and that can potentially be cleared. We see that also in backs, right? I mean, people who have back issues, many times it's something that is related to, some unexpressed trauma or stress in their life. Well, here's this baby that's born, and all of a sudden their permanent grown-up teeth are forming, and as they grow, those teeth continue forming. And so at some point, if a new trauma comes and everything's already occupied, like the organs are already occupied, but there's new storage in these new teeth. Where's the easiest, the path of least resistance? If you're going to store some trauma or some upset, something happens in your family or, in your life, and you can't process it in the moment, it becomes blocked energy, which is what I call, dis-ease trauma. It's going to go somewhere. It's going to be held somewhere. And I assert that it gets held in the mouth. Gets held other places as well, but in the mouth, it can be held, and it can be based on when the tooth was forming in the bone, or when the tooth comes out, when it erupts. It joins the environment in your oral cavity, right? a perfect example that I have of this is I had a patient who had come in and said she never had any problems until she had her wisdom teeth taken out. And I said, "Oh wow, that's really interesting. So was there something that happened at that point, or I mean, what were the other issues that happened in your life?" And she said, "Well, no, nothing really." And then I looked back and I said to her, "Wow, look at when this tooth was in development." And I can't remember if it was, something like she was 7 or 8. It's like that's the age when it starts to develop in the bud stage. And she said, "Oh, well, my grandfather died." And I said, "Oh, wow." And as she was talking, I was, intuitively getting information. I could see there was, and I could see that there was fear, and I could see that there was heartache, and it was connected to the heart. And I said, what did he die from?" She said, "Oh, he died from a heart attack." Okay. And I said, "Well, did anybody know?" And she said no, and continued to just look at, wow, well, so your family was upset, you were a child and you couldn't process, and the whole family, it caused a major disruption, and during that time, it could have, I mean, I can't say 100%, but it could have been connected to the fact that this is a tooth that then needed to come out. It couldn't stay in her body. She had to let it go.
Wow.
So that's an example for me. And sometimes, I mean, I'm from New York, so sometimes when these things line up, I think, how is it possible? How is this possible that it could be related? And yet at the same time, I recognize that, when I think across the world with all people, not everyone has back problems, not everyone has kidney problems, not everyone has, you know, hypertension or heart disease or any of, people have different things. But if you ask, do you have something with your mouth? Do you have something dental? Pretty much everyone has something,
Right.
which is why it speaks to me that there's something about that. There's something that's universal about how we are not always processing traumatic events, because sometimes you just have to survive them, and they get stored somewhere. And where's the easiest place to store it when you're in, the formative years where you don't have say over what's going on in your life? It's the teeth. And, this is what my observation is. And that's why I think it's important that when you're doing a self-assessment, that you want to also look back. It could be something simple like, okay, well, you were in a sports accident and that's what happened. But sometimes it can be something that's not like a traumatic impact that happened to you. It could just be what's going on in your world, what happened in your family, what was the situation that could have not necessarily been fully processed. And, again, there's many reasons why that happens. You just have to get through it, or for whatever reason.
That makes sense. And I think, a lot of people, oftentimes there's I'm sure people that of that eat a tremendous amount of candy, that may not brush their teeth, and have no cavities or no issues in their mouth. And then others who, brush and floss religiously and, and they don't even necessarily would be eating a lot of sugar, and they might have a lot of problems. So I think there's definitely, it seems to me at least, and especially from what you're saying, that there is definitely something emotional to the trauma that we store in our mouth, and where we pick it up, within our journey from adolescence into adulthood, and how early it starts. So
yeah, I mean, there's an aspect of it that I say, it's mind, body, spirit, right? So there is an aspect, to clarify, it's not. There's other things that also require looking at. It's not always the diet. It could also be their metabolism. It could also be, how the position of the teeth are in their mouth. It could be related to the shape of the teeth. It could be related to, there are many factors to why people have dis-ease or decay or challenges. But what I like to think of is, we don't typically address the energetic aspect. We usually just, you know, treat the symptom. And, so long as you're only treating the symptom, there's something that can still be sitting there. It's not sufficient. I mean, there are many times where, it's like you said, they treat the tooth over and over, like it'll need one thing and it wasn't enough. And that's where you want to really look at, is there something else that I can do to help support this? And if you get one thing handled, that's one less thing on your to-do list. That's
Right.
one less stress. And given the world that we live in, why not? Why not help alleviate some of that if you can?
Right. Right.
We all have a capacity for a certain toxic load. I mean, this is what I think of, and the toxicity can be energetic. It can be just environmental. It could be what the person's diet is, how their body metabolizes it. It can be, electromagnetic frequencies. People have many different types of sensitivities, and we all have a different amount that we can bear, that we can hold. And so sometimes that gets tipped out of balance. And when there's an out of balance, it can show up with disease, with illness, with, all of those things like decay, or where, there's inflammation and bleeding. Many people don't realize that, when you have bleeding, basically that's an infection. You've got, no part of your body should bleed without there being a reason for it. And so these are like aspects that, you could say it's energetic, but it could be that the person just isn't flossing.
Right. Right.
And they need to. So it's about looking at the full picture is what I mean. This isn't the magic bullet that all of a sudden is now the person is going to be doing a meditation and all of a sudden now their mouth is all happy, happy clappy. But it could be that you do that and you clear something and then it opens up another area and now you're freer and you're able to work through towards health that maybe not, you might not have thought is related to your teeth, and it's actually related to something in your body.
Right. Interesting. Fascinating. Samira, can you tell us what exactly is holistic dentistry? It's a kind of a new term for me, and I'm sure a new term for a lot of people. Can you tell us a little bit more about what that means?
Yeah, so holistic dentistry is looking at a person like they're a whole being. It sounds like it's obvious, but for many people it's not. It's about recognizing that what you do to a person anywhere in their body, especially in their mouth and with their teeth, will impact on the whole person. It's about checking to see if materials are in alignment with the person, whether the person has any kind of allergy to it. It's about, again, just really knowing that whatever a person does in your mouth is going to basically stay for a long time, for decades, and taking that responsibility seriously rather than just, sticking whatever it is in the person that may be fine. It might be fine for one patient, but then the next patient will have a negative reaction to it. One person might be allergic to strawberries, the other person loves them and is fine with it. So it's the same thing with the mouth, except, as I said, it lasts a lot longer. And I often, when I do my lectures, people are surprised when I reference that your mouth is part of the rest of your body. People tend to compartmentalize and they think, oh, well, that's not, I don't really have this issue. I'm taking blood pressure medication. Why do you need to know? What does that have to do with my mouth? Well, it has a lot to do with your mouth because ultimately you're an entire being, and many of the bacteria that's in the mouth is linked to heart disease. It's also linked to diabetes. There's, evidence that it's related to Alzheimer's. There's all of this documentation that people don't really recognize outside of the dental world. And specifically, holistically, as I said, it's a big honor and responsibility to take care of a person, and it's the entire person, I often say, I can't help you directly with your kidney, but I can take care of it in your mouth. I can help
Right.
support you. If there's bleeding around this tooth and it's related to your kidney, let's take care of that inflammation that's in your mouth and then see how that electrical, Christmas light that goes down to your kidney, how that's helped.
Right. Makes sense. Very interesting. And I think, the materials that are put into your mouth is such a big topic and big conversation. I think so many people don't really, have even a conversation with their dentist about what they're actually doing to your mouth, right? You just go in and maybe get a cavity filling, but oftentimes I think most patients are not asked unless it's like for insurance purposes or payment purposes, what type of filling it is. And I think, we can maybe all agree or not about the mercury fillings and how much damage that's caused or has the potential to cause later in life. So yeah, so I've just been very curious about that and also root canals, but we can get into those topics later.
The thing that's interesting in dentistry, so that is that amalgam mercury fillings are still allowed. They're still used. From my understanding, last year, I believe NYU Dental School decided that they wanted to stop having their dental students place mercury fillings. I mean, an amalgam means a collection of different metals, and the mercury is in there as one of them. And when they did that, the Board of Examiners threatened to withdraw their certification, their ability to teach and have dentists produce. So they had to put it back. So it's something that is recognized that mercury is detrimental to it actually impacts on the nerve sheath. So the way that I think of it is you've got the plug that goes to the wall, and you don't want those wires to be exposed, right? Because that's dangerous. Well, our nerves have that. They have like a plastic coating, so to speak, in the same way that a plug does. Mercury damages that. So then now you have like the raw copper wire exposed. And so not only is that detrimental, but it also then becomes more detrimental for other metals to impact, because now that part of the nerve is naked. And so everybody agrees with that around mercury. The disagreement is how it's not linked to the impact that it could have on the mouth. And so it's a very controversial thing, because if you say this is bad here, then why is it not bad in my mouth? And so that's where the debate goes. I mean, I have a very, very dear friend who's a dentist. He is a dentist still in Colorado, and he's been practicing, again for decades. When he first opened his practice, he said that they had a guy come in and check his amalgam disposal. It was a specific inspection that happened where this person needed to verify that you were disposing of the amalgam mercury, that mercury's in the amalgam, in a way that didn't impact on the environment. And so he said to him, and this was maybe like in the 70s or something, he said, well, I don't understand how, you're checking this as it pertains to disposing of it, because it's not good for the environment, but it's okay to put it in a person's mouth. You can't throw it away just in the garbage bin, but you can put it in somebody's mouth. And he said, the guy said, well, this is I can't answer that. This is just my job to just check that it's inspected. And from that moment on, this friend of mine refused to put any amalgam in another person's
Wow.
body. If it's not safe enough to throw it in land, these metal amalgam fillings, how can you justify then that you're putting it, and sometimes they even put in children, and it lasts decades. And so that's the part that, and perhaps there was a point in time where that was the only option that was available. That was the only thing that could do the job and withstand the forces and all of those things. That's not the case now. So regardless, my personal feelings on this is that regardless of whether, you think it's bad for you or not, if there is an alternative that does not have a toxic metal in it, why don't you just go with that one?
Right.
Just pick the
Right.
one that doesn't have the mercury, and
Yeah.
and then you can have whatever opinion you want. It's all good.
Right. Yeah, it makes a lot of sense. I mean, I think I also heard, I don't know where I heard this, so take it or leave it, but I heard that the reason why dentists have such a high suicide rate is because of all the mercury feelings, because they also get exposed to the mercury, and it causes depression, it causes um, you know, some sort of damage internally.
I wouldn't be surprised. I mean, I just think about. I mean, what came to mind was Van Gogh, and with his, we recognized lead was not a good thing to paint with, after all, right?
Yeah.
After the fact of insanity. I think, there may be something to that. I can't really confirm or deny. I just also know, it's not an easy position to be in, where people, have dread for coming in, they have discomfort, and most people don't recognize that the best type of relationship to have is one of partnership, nor do, many dental people. It's almost like your dental mechanics, as opposed to, you know providers of solution and health. And that's not a blanket statement. It's just there are many people that just, it's just, okay, you've got, we'll drill and fill, and you're helping to a certain extent, but if you don't address the deeper issue, and ultimately also take responsibility for how you feel. If I'm not happy and I'm making a meal for someone, they're going to have that in their body for a certain amount of time. But if I'm not happy and I'm putting a crown on a person, or I'm putting a filling, and that's going to last for years, how is that, you know, a kindness? How is that acting with kindness? How is that not recognizing that we're all linked and all of our behavior has an impact on each other? That's a separate podcast that you can have with me. We'll be
Yeah.
here all night.
Yeah. So I wanted to actually ask you, Samira, what kind of patient usually comes to you for help that maybe doesn't want to go to a regular dentist?
Yeah, well, so that's a great question. So the patients that come to us are patients who are very well informed. They've read many times. The patients will share with me certain products that they're using. Again, it's a relationship. It's a partnership. Yes, I'm an expert in what I do, but they are an expert on them. They're an expert on who they are. And so all I can do is help guide them through their process, so that we can get them to the healthiest that they can possibly be with their mouth. That's not a common philosophy, unfortunately, I could say, in healthcare in general, not just in dentistry. There are patients that have come in to me who said, I was fired from my dental office because I was crying. I was like, really? What? Why were you crying? Well, I was crying because I was upset, and I was sharing how there was, this tooth was really bothering me, and I didn't. The previous dentist didn't do what I wanted them to do, and they just want to do what they want to do. And I said, okay, well, I get there's like a level of compassion that's needed. So people come to me who seek compassion. People come to me who seek, the absence of judgment. People come who want to be honored for the courage it takes to trust another human being to work inside of their body. People come to me who've had, negative experiences elsewhere. People come who need a second opinion that isn't necessarily, radical. Sometimes people will come and they have like the beginning of decay, and their dentist says, okay, well, let's fill it. And they think that that's preventative. Sometimes there's ways that you can arrest, or even partially reverse decay. That's not a philosophy that's usually shared. We live in an age of dental insurance that is dictating certain procedures. you get compensated for, restoring things. You don't really get compensated for preventing the breakdown.
Yeah.
You get compensated, it's like a cleaning. No, this to me is, what I do, helping people limit the amount of inflammation that they have in their body. That to me is not, it is essential. That to me is essential. It's not, an optional, okay, well, I just want to look good. You look good because you're healthy.
Right.
When it's not healthy, it doesn't look good, but you're not coming just so that you can look good. You're coming to me because you're wanting to take responsibility, take ownership of your overall health, and, accessing it through the mouth, which is the portal to the rest of the body.
I'm curious, Samira, what sort of things have surprised you in this journey, in your practice?
Well, so one of the big things that surprised me in this journey is that I'm a dental intuitive. There was no other dental intuitive that I'd ever heard of. It was something that just came because I had a patient who'd been coming to see me for quite some time. And every time she needed her teeth cleaned, she needed to be on nitrous. She did all of the things. It was actually an amazing woman, very successful in her life. She helps children that have been abused, and she's a social worker, psychologist, person. And I was taking care of her that day, and I got an intuitive hit, and I said, is it okay if I share with you what I got? And she said yes. And I said, well, many times people come in, and when they have the nitrous, it could be because something bad happened to them. And so in that moment, she just started crying and just, had a breakdown, which was amazing because it happens to me. As I said, it happens to me a lot, not because of what I'm doing to them. It has to do with my holding space, or, the emotional aspect of this type of work. And so she said that she had been molested by her dentist, who was her neighbor, and that her family made her go and see him, even though she kept saying she didn't want to go. And they kept having her go because they thought it was, oh, this is another dental. Nobody wants to go to the dentist. You still have to go. Well, the outcome of that was that as she got older, what I recognized was that she couldn't allow herself to accept any of the wisdom that he had, any of the good things that he may have said, like flossing is good, brushing is good. She needed to completely reject everything because of the horrible things that he did. And so that ended up having a huge impact on her life, for the rest of her life. She's got dental issues, right? And so after we had this discussion, it was remarkable because in the next visit, she was still doing the same as she'd always been. And now her gums weren't bleeding. Now her mouth was better. It was for me like this complete surprise. And that's when I got, oh, this is what I'm supposed to be doing. This is why I've been in dentistry for 30 years. This is why, because I'm an artist, and I'm a singer, and sound healing appeals to me. Art therapy appeals to me. So many different aspects and avenues that you can use your medical intuition towards, being a spiritual coach. All of those things I have an affinity to. And I always wondered, I love what I do. I love being in dentistry. I love helping others so that they can, fish for themselves. I don't have to fix all of their problems. I can just support them on their path. And I recognize that my sound healer friends, they can't be dental intuitives because they don't have the knowledge and the experience that I have. And, the art therapists can't do it. So there's no choice but for me to be a dental intuitive. It's not, as I said, it's not a sexy path to use intuition in. But I also, as I've said, you don't hear of very rarely do you hear that people don't have some issue in the mouth. And if it's not me who can see that correlation between spirit and physical and body, then who? And so that was when I stepped into it, and that was a few years ago, that I recognized that, yes, this is what I have to do, and this is how I can help others so that they don't have trauma. And my personal experience, I'm a dental phobic. I've had negative things happen to me in I've had teeth issues, and here's my confession, right? And my family always wondered, how is it possible that you went into dentistry? How could you possibly, and my mother got me the job. That's what I say. And I fell in love with it. And I recognized, having been a child who had literally been kicking and screaming coming into the dental chair, where they had to, adults had to strap me to the chair.
Wow.
To take care of my teeth. I thought to myself, wow, I don't want that to happen to anyone else. Like whatever it was that dentist, whatever little filling he needed to do that he felt was so necessary that he had to strap an 8-year-old child to the chair to do, that filling is long gone, but the impact has stayed.
Yeah.
And thankfully now I can look at people who come to me who say, I had, this dentist, it was this or this. And okay, yes, I know. I do not wish to have that perpetuated. And if even slightly, I can just alleviate some of that for another person, I have no choice but to want to do that. I'd rather it be like something glamorous.
Yeah. And I mean, I think what you're doing too is you're creating essentially a new field, which is the intersection between dentistry and intuitive medicine. And I think, you're humanizing dentistry. And I think because so many people go to the dentist and still feel like it's a clinical experience, and the human aspect, and especially the spiritual and emotional aspect, but even just the human aspect is not really there. So I sincerely love your approach, and I wish every dentist
Thank you.
Could bring all those aspects to what is often not a very fun visit to make. So thank you so much, Samira. And just a couple last
Thank
questions. What's the main takeaway that you want to tell our audience?
Your teeth are people too. No. So love them and appreciate them, and recognize that they have a role. They're not just laborers, right? Actually, so my main takeaway, would be, recognize that your mouth is part of your body, and that any part of you, all of you, needs to be cherished and loved and valued and taken care of. And if you can look at taking care of your mouth, if you think about, you don't dread washing your hands, because you love your hands, and you don't dread putting lotion on your hands so that they're soft and lovely. Also, wash your mouth in the same way. You think of it in the same way. Don't think of it as, oh, I've got to do this, as a terrible thing. Think of it as love.
Right.
Loving your mouth is loving yourself.
Beautiful. Yeah, that's a great takeaway. You've given me a lot to think about as well, as I'm sure the audience. And are there any resources or maybe books that you can point folks to? What has inspired you in this space? And also, where can people find more information about this topic of holistic dentistry, intuitive dentistry?
Well, so the intuitive part is still, as you said, it's something that I'm hoping will, inspire other people to recognize the calling to be in that role. So pretty much I'm it when it comes to the dental intuitive. But you can also look at books. There are books that are written. One of them is called The Mouth Body Connection by Gerald Kuratola. I'm probably destroying his name. Another one is Radical Medicine, which is by Louisa Williams. And, it's cutting edge natural therapies that treat the root cause of diseases. It's like a tomb. This book is not just for dental. It's like, if you want to go holistic all the way with everything, amazing resource. There's the Whole Body Dentistry Complete Guide to Understanding the Impact of Dentistry on Total Health. There's Dr. Douglas Cook, and his book is called Rescued by My Dentist, New Solutions to a Health Crisis. These are all recognizing the relationship between the body and the mouth. If you want to look up and find a dentist or have more resources around or professionals around having more of a holistic approach, there's a website from the International Academy of Oral Medicine and Toxicology. It's iaomt.org. And so those are some of my recommendations and resources. And people can also feel free to reach out to me. I'm always honored.
I just wrote all the book titles down that you mentioned. So I've never heard of them before, but they seem very interesting. So I'm sure that our audience is going to greatly benefit from this. Thank you so much for your time, Samira. This was just an incredible conversation. And I feel like I learned a lot about holistic dentistry, intuitive dentistry, what it means to store trauma in the mouth, what it also means to have a new relationship with your teeth and with your mouth, and essentially, humanizing the experience of going to the dentist. So thank you so much for your time. And for those of you who want to learn more about Samira, you can reach her through her website, www.thepolishsmile.com.
Well, thank you so much, Yasmin. It was an absolute pleasure. I'm so honored to be included and I hope that there was something that was useful in what I said.
Thank you. Yeah, absolutely. Absolutely. And for our audience, thanks for joining and for listening. In this episode, we learned about where we store trauma in our teeth and how we can clear these traumas. So tune in to Gateways to Awakening, where we host one-on-one conversations with leading experts in wellness and spirituality. Thank you.